Good morning, everyone. This is Jim Chesnick in the Department of Human Services. With me here in Des Moines are Matt Haynes and Janae Harvey. And we're going to talk a little bit today about CareMatch review. We've had various trainings over the last several weeks. And today is really kind of an opportunity for us to take a look back and we've been looking at how people have been making entries. We've identified a couple of problems here and there, and that's really what we're going to talk about today. What we're going to talk about today really doesn't have so much about how to use necessarily this application, the CareMatch application. That has been handled in the trainings in the past. Really what we're going to talk about today is different parts of the system where we've identified either some errors or there have been some bugs reported to us, and we'll talk about some fixes that have been made and that sort of thing. Alright, we're going to talk a little bit today about incomplete or inaccurate entries. We'll talk about different entry types. Again, I mentioned, I think, already recent bugs and fixes, and if there's anything else at the end that we need to give you some reminders about. One thing we had wanted to do today was to go to CareMatch Live and actually look at some of the things up on the screen. We were unable to do that really based on information that would either be identifiable for children in the system or particular things that are relative to your contractors, agencies, and so on. So we weren't able to approach it from that way. We've tried to put in a couple of screen captures, some things that we've identified prior to today. So we'll use a few of those. But for the most part, we'll just simply be going through these things kind of point by point and checking those out along the way. Really consider this a supplement to the CareMatch guidance that's been previously provided. That's been sent out to all of our contractors. That pretty much laid out what and how the system should be used. So our service contract specialists have gone through not only the training but also some review things so that they will have a good understanding of what it is you're doing when you make your entries and how they'll be able to monitor that along the way. Some things you'll hear today will certainly probably be repeated from things you've heard in past trainings. Other things will be clarified. We're not trying to be repetitive, but sometimes we see the same things kind of happening over and over. So that's how we're going to approach it from today. One thing I want to say, I've gone to the next slide here, but let me just say this. We started looking at CareMatch and its utilization really from the beginning, very early in July. Early on there, we noticed a lot of things that were made, entries that were made incorrectly or errors were made. In some cases, you weren't able to go back in there and make corrections, but the system now has been updated so that you can do that. But I'd like to say in the last couple of days, when I went in there to look for some screen captures to give as examples, things look pretty good. So I think really everybody's kind of picking up on this, and it's coming along quite well. I just wanted to point out that when you go, first of all, I guess if you need to get your login information, as I mentioned earlier, we will give you that information sometime after this webinar to tell you exactly how to do that, so that we give everybody at your agency access to this system. But this is just a reminder that if you're having problems accessing the system, or if it's not available to you when you try to log on, those kinds of technical problems, please contact the CWIS Help Desk at the email address that's noted on the screen right now. And I'll ask Matt very quickly. I don't know if the number of questions have those kind of diminished over the last couple of weeks. I think they were pretty numerous at the beginning, but I think people are getting the hang of it.
Yeah, they have trailed off.
But the help desk is ready to answer any of those kinds of technical questions, so please feel free to contact them. All right, we're going to talk a little bit about child search. One of the things that we wanted to point out today is that to be sure when you make a new entry into the system that you go through the child search and try to find out if the child's already been entered in some part of the DHS data system. We want to make sure that we avoid duplicate entries. We've seen that a few times where a child's been listed twice or maybe 3 times. One of the things that's been fixed recently is that when you enter a child's state ID, you will receive a notice if that's already part of the system. So anything that's been duplicated, that's kind of a nice fix that just happened recently. I don't think before you got any kind of a pop-up or a flag which told you that. So you pretty much had to rely on the other information, first name, last name, date of birth, etc. But if you type in a duplicated state ID, you will be notified at that point that the child is already entered into the system. Referral dates also have to be entered correctly. We've seen a couple of problems with this, either when a referral date has been omitted or when it's been entered and then other data that might relate to the referral date is not entered. That's resulted in a couple of different things. kind of in this example that you see right now, it resulted in the outcome showing as pending. We're not always sure what that means. There really should not be any kind of a pending status for any extended period of time. We'll get to that, I think, in just a minute or two. But it's really important that you include the appropriate referral date and any kind of follow-up information.
Jim, I'd like to add just one more thing to that. There's also a time that needs to be associated with that date. And Jim, correct me if I'm wrong, but I think in the initial training that we did with providers, we indicated that if a child entered care prior to 7/1, sometimes they've been there for a while, they might not necessarily have on file what the referral date, and certainly not the time for those kids longer ago. But we still need to have a referral date and time entered in there, so they can, I think we agreed they could put in, if they don't know the actual referral date, the same date that the child was admitted to their facility or in that service. So that would be part of the cleanup that we would hope to see.
Okay, very good. And we will come to it sometime later in this webinar, but there also has been a recent fix that you are now able to go in there and correct any inaccurate entries or mistakes, or if you entered a child twice and then you tried to take them out knowing that you had made a mistake. You weren't able to do that before, but that is one of the fixes that's happened in the last few days. So you will be able to go back in there and clean that information up, and we will ask you to do that over the next couple of days. Yeah, as Matt mentioned, there's a time frame on when you should get the information entered. Really, pending should not appear in any of our data here for more than 2 hours. That's the 1 hour whether you will accept or reject the referral, and then also after you've made that decision, then you have another hour to make the actual entry. So we'd like you to make sure you go in there and make sure all that information aligns with each other. One of the things that we've discovered, we think, it's the second bullet on this page. CareMatch should not be used to show a waiting list. Now, a waiting list, on the one hand, for group care, is managed by each individual DHS service area. That's been in place, for the last 10 years or so. It's been a long time. So they do have a wait list process. The waiting list I'm talking about here is what we've discovered that some of our contractors use. It's when a child is referred to them, they might not have a bed, and they say, well, we'll be able to take this child after we get a vacancy. CareMatch should not be used to track that. Okay, we don't want you to show that a child with that sort of status, as either occupying a bed or as officially being referred, but then not play or something like that. If in fact contractors are still using what I guess would be called an internal sort of waiting list, that should just be tracked individually by contractor and shouldn't be represented here in CareMatch.
This is Janae. I want to just emphasize one of the roles of our contract specialists throughout the state is actually going to be accessing CareMatch as a quality assurance tool. So for them, if they're going in and seeing a kid in pending status for more than 2 hours, let's say 2 days, 7 days, 14 days, do not be surprised if you're getting a call from them, because it will appear to them that you are not following contractual obligations of giving the 1 hour response time and then making arrangements for that kid to be accepted into your facility or program within the following hour. So this will be really important. It has impact as it pertains to your relationship with your contract specialist if this is not being used in the right way.
Okay, we'll go on to slide 8. A couple of things we noticed also has to do with rejections. One thing we want to make sure people don't do is to actually enter a referral date but then enter either rejected or not admitted, if in fact the reason was that there were no beds available. If no beds are available, please don't make any referral entry at all. And when we talk about legitimate rejections, this is ones that use the protocol, the admission and discharge protocol, to decide whether or not a child will or will not be accepted. But anybody in that sort of status should not ever be shown as actually occupying a bed. Okay? Because this, again, CareMatch is really supposed to be a real-time live system, and when referral workers go in there and access the information, we want it to be as clear as possible which beds are available and which are not.
So Jim, I think it might be helpful for our provider community if you explain to them, if they are at capacity and they receive an email from DHS or JCS with the referral form for a kid, Can you explain what that should look like in practice for them?
Well, I think, yeah, they might not only receive just the form email. I think there would also be a follow-up call, perhaps by the referral worker. But if they have no beds available, I think they should communicate that back to the worker and say that we just don't have any empty beds. CareMatch might show that there are vacancies, but if it's not kept up to date, the worker might not know that. And then the worker at that point, if there wasn't any bed in the contract that was available to that child, then they would have to start thinking about placement somewhere else.
Okay.
So that should be communicated back to the worker right away.
And that would be an example of where they would not document that as a referral in CareMatch.
Right.
Jim?
That's right. Okay, let's talk about entry types a little bit. There are different kinds of entries that are made in CareMatch. One is for guaranteed payment beds. That's in both foster group care and in CWES shelter. That will also be true for the supervised apartment living when those contracts come on board on October 1. We'll use the abbreviations for the purpose of today's presentation as GB for guaranteed beds. In group care, there will be 3 different levels, perhaps, if the contracts for all 3 different group care payment levels, either D1, D2, or D3. There are also non-guaranteed beds. We'll use the abbreviation NGB. And again, that would be identified in everybody's contract by number if they have any non-guaranteed payment beds in their contract. CareMatch will also show additional beds. We'll use the abbreviation AB. Now, the additional beds is the difference between the contracted number of beds, which is the guaranteed payment beds, together with the non-guaranteed payment beds. Those are actually the contracted beds. The additional beds would be the difference between those 2 numbers added together and the licensed capacity of the provider. Okay, so I think a few questions came up early on, what did additional beds mean? Where did that come from? But that's essentially what that means. If anyone notices that the additional beds or the guaranteed payment or the non-guaranteed payment bed numbers are not correct in CareMatch, let us know that right away so that we can get that corrected. I think we noticed 1 or 2 things like that happen early on. Those have been changed and fixed. But if anybody sees that along the way, or if at some point you change your number of licensed beds, which would create that number of additional beds, please let us know about that too. Because not everybody who works with this system is privy to the information of licensure, and so that's just not directly and immediately communicated to everyone. That information kind of resides in certain. The other kind of entry type you'll be making is for diversion. Now, this is not a bed entry, but this is still recorded in and tracked by CareMatch. It's important to make sure your diversion entries are accurate and up to date, because this will be information used for the performance measures in the CWES contract. All right, getting back to guaranteed beds, again, we haven't really seen this much in recent days, as we've done our spot checks. But earlier on, we noticed that there were some guaranteed beds shown as vacant, while other beds were reported, either non-guaranteed or additional beds were reported as being occupied. But one thing to keep in mind is that if any guaranteed beds are vacant, there should be no numbers, or at least not any number above that, shown to be occupying non-guaranteed beds or additional beds. So all the guaranteed beds that are in a contract should be filled first and reported that way. Then you start to get into the other sections of non-guaranteed or additional bed reporting. A question that has come up along the way is that when you have children occupying a non-guaranteed bed or additional bed, and then you get a vacancy in one of your guaranteed beds, how do we move the children into that guaranteed bed? Well, what we've put in place is sort of a first in, first out. So the first person who went into a non-guaranteed or additional bed should be moved into that vacated guaranteed bed. The question has also come up, into what level of guaranteed bed do they go? Is it one of our D1 beds, or is it one of our D2 beds? And basically the answer to that is that they move into the first vacant bed. Okay. We've sent out a reminder about this, I think about a week or 2 ago. When this happens, you need to immediately, first of all, record it in CareMatch, to show that move. And then you also need to immediately notify the referral worker so that payment will be handled appropriately at the end of the month. You want to make sure that you're paid correctly for that utilized bed. Now, it's not as important to notify the referral worker when a child is moved from, let's say they move from a D2 bed, if you're considering it that, in your non-guaranteed area, and they move into a D2 bed, after the move into a D2 guaranteed bed. That doesn't matter so much. But anytime there's a change in payment level, it's really, really important to notify the referral worker, okay, of that move, so that the payments can be appropriately done later. This doesn't, I think, come as any surprise to anybody, but the service area manager or the service area manager designee needs to approve all use of non-guaranteed or additional beds. So when the guaranteed beds are full, they'll be going through that approval process to put a child into a non-guaranteed or into an additional bed. When the placement is approved, the contractor will be paid at the highest level of payment bed that is in their contract. Okay? I think everyone understands that, but let me just touch on it quickly. If a contractor has D1 payment level beds and they also have D2 payment level beds, anytime a child is approved to go in, and those are all occupied, let's say, anytime then that the child is approved to use a non-guaranteed or an additional bed, they will be paid at the D2 level in this example, because that's the highest contracted payment level for that contract. One thing you've probably noticed in the last few weeks is that to show availability in CareMatch, all the additional beds at a contractor are shown at the highest level of payment. So again, if you're logged on to CareMatch right now, and if you're able to get to this screen, you would look in there and you would see, for example, somebody who has 3 different levels of guaranteed beds in their contract. D1 would show the number of guaranteed and the number occupied. It would show the number of guaranteed for D2 and the number that are occupied today, and it would show the number of D3 that they're contracted for and the number of guaranteed beds that are occupied at the D3 level. All of the additional beds for that contractor that had all those 3 different levels of payment would be listed across the row from D3. All right, because again, that's how they would be paid for additional bed use, and that's the way that they're being shown as far as availability goes in CareMatch. And I think the final bullet there is just kind of a reiteration of what we've already said. Now again, as I mentioned a few minutes ago, diversions in CWES, Child Welfare Emergency Services, need to be accurately entered into CareMatch, because that will later give us the numbers for diversion and help us calculate performance measure and incentive payment. We've also noticed a couple of inaccuracies or errors in this respect. It's important to enter all the proper dates from the beginning and the end of the diversion service. Okay? We want to make sure people don't confuse diversion activities, which in some cases might involve the use of a bed in that 47-hour respect, but it could also be for the other alternatives that are provided by our contractors. But we want to make sure that they don't confuse diversion activities from actual shelter bed placement. Those are 2 different episodes of care, and they should be reported as 2 different episodes in CareMatch. If a diversion case ends up being placed into a shelter bed, okay, those are 2 different episodes of care, and they should be reported that way. If the shelter bed is used for diversion, again, that up to that 47-hour time period, it should still be reported as diversion, and that particular child should not be shown to occupy a bed, or it should not indicate any kind of change in availability of a shelter bed in CareMatch. Okay? Those numbers still need to align with and correspond to the number of contracted beds in an individual CWES contract. And as I mentioned, there are other diversionary techniques that are used by our CWES contractors, not only the 47-hour bed, but whenever any of those other things are applied to a case, that still gets entered as a diversion and underway. Now, when a child leaves the diversion activity, regardless of how long that took, it might take up to that 47-hour period, and then they end up in a bed because the diversion was not successful. Or it might be a number of days when they used the 47-hour beds, perhaps during a time period, and they also did some other things. But when that child leaves the diversion activity, they should actually be entered in the CareMatch system then with a service end and discharge date and time. And that will indicate that the diversion episode has concluded. Now, if again that results in then the child moves into a bed and they come with a court, or they have a court order now putting them into a bed, then that is the time you would show that as a CareMatch entry as an occupied bed. Okay, this is an appropriate time for this. When a child is in a diversion bed and then they become a CWES bed, and I mean, do they get then placed into shelter, do we use the date that they became a diversion or the CWES bed as the referral date? Well, I think in this case, and I'll ask Matt in a moment here, I think what you would be doing is you've got a referral date that you will enter for the diversion. You will then have a service end date for diversion. And then that child would become, again, a different episode of service when they were placed into the bed. So I think, Matt, they would also have a new referral date, right, for the bed entry?
Yeah, they would have a new referral date, and I would say it would be the date that they went into or needed to be counted as a formal shelter bed placement as the referral date.
Thank you. So hopefully that answers that question, and I think, again, you'd have 2 referral dates and 1 end date, and then you would have a second end date when the child leaves the shelter bed placement. So I'm going to move on, and we're getting through this pretty quickly this morning. But I wanted to do this kind of a review of recent bugs and fixes. At the beginning, there was a spot on the referral screen where you select the entity. That has now been made into a drop-down box. I don't believe you had that choice before, but now you have the opportunity to go back and look at all of your entry screens, or your referral screens, I guess I should say, and choose the appropriate entity and identify them for that particular referral. That is something that we'll ask you to go back and do as quickly as you can. Hopefully that's not going to be too much of a task for everybody, but it's pretty simple, I think. You know, you just go back to all the children you've entered in CareMatch thus far, go to their referral screen, and make sure and confirm by actually selecting the appropriate entity as identified in that drop-down box. So we'd appreciate it if you folks would go in and do that.
So just a little more clarification on that. The only options that will be in that drop-down box will be any JCO or DHS worker that we have set up a user account in CareMatch. So in the event you have, let's say, a police referral, you will not find, law enforcement names in that drop-down, or maybe you get a referral from a juvenile court officer that we do not have set up in CareMatches yet. In those cases, you have the option in the drop-down of selecting other, and at which point you'll be able to enter in a first name and a last name and the various contact information for those individuals.
All right, thank you, Matt. The ability to correct past error is a new thing that you have now. People hadn't been able to go in there and do that before. It's been tested. We think it's working for everybody, but we'd like you to go in there and anything that's in your CareMatch reporting that you think is either an error or was an inaccurate entry, or you've got a child entered in there twice by mistake. We've seen that happen a couple of times, and then you haven't been able to go back in there and remove that entry. We want you to all test that as soon as possible. Let us know if you're having any problems with it, but we think that that's working fine for everybody. So you should go in there, you should be able to go back in there now and delete any, you can delete an entire entry, you can fix placement types, referral information, any of those kinds of things I think you'll have access to correct. One of the things too that hadn't been in there before, and I don't know if all of you looked at that as much as we have an interest in here, the system now identifies for each child the DHS service area from which they came. So as you know, our focus this year is on placing children within their own service areas as close to home as possible. And what had been up until this point reported was the county of placement. So for example, if you're let's say a group care facility was located in Des Moines, every child that was placed there, regardless of where they came from, was listed as Polk. So, in the Des Moines service area. So now that's been corrected so that it accurately shows the DHS service area of origin. So we think that's a nice feature, at least for us. Okay, we're really getting ready to wrap up here. I'm going to ask Matt or Janae if they have any other things they want to make sure we touch on before I kind of give this little summary here with the different links you can use for additional information. Matt?
I'll just add one thing. Though it's not in production as yet, since Jim kind of wrapped it up on bugs and fixes that have been put into place here recently, one thing that will be coming here in the near future is a fix of both the referral history and the placement history on the provider face sheet where all the kids are listed for your facilities. Once those are fixed, you'll be able to go in there and pull out all information, all fields for each of those kids in an Excel document, so that at any given time, if you need to utilize that information internally within your agency, You'll be able to pull that information based on start and end dates. You can pull it all. You can pull a piece of it based on date parameters. So that's coming in the very near future.
Okay, this is Jim again, and I'm just doing a quick review of we have one or two other questions that came in. Let me see if they're applicable today or if we'll put them in the Q&A. Okay, yeah, this looks like a technical question that came in, so perhaps a problem with the CareMatch entry, and we'll get back to that one after today's webinar. So let me take us back into this sort of summary page here. You should see a list of numbers 1 through 4. Numbers 2, 3, and 4 are all available from number 1. You know, if you want to start there, that's the DHS Home Page. But if you go there, and I've included these links here too, but if you go to the DHS Home Page and then go to, I guess I didn't include it here, but if you use the link, it'll take you directly to it. But it's under Providers and Partners on the DHS Home Page. You will see System of Care. Select that. That will take you to all the things we've been talking about with CISR. It also includes information about RRTS, which wasn't the subject of today's webinar, but you might also be involved with those contracts. And there you will find information on implementation, you'll find information on contracts, you'll find the Q&As, and a lot of other things that are located on those pages. So hopefully those links will be helpful for you. Now, if you have any questions after today's webinar, again, this will be posted. We'll let you know where to find this on the DHS website. Certainly contact your service contract specialists, and I know you're familiar with all of those folks in your local areas, or you can give me a call at 515-281-9368, and my email is also listed on this final page here. So this concludes today's webinar. Thank you all again for taking part. We appreciate your efforts. We think things are going pretty well, you know, with a brand new focus really on all of our activities. We think we've gotten off to a pretty good start, and I think a lot of that is due to the cooperation and collaboration that we're having with our partners out there around the state. So I appreciate all of that hard work. Thank you all.